Sarah is a 59-year-old patient who has been recovering from the hospital after a major fall in her home. Today, she is getting discharged from the hospital, and the doctor has instructed her that she needs to see her PCP for a follow-up visit within a week. The ISP coordinator didn't have any issues scheduling Sarah for a post-discharge appointment with Dr. Kim within 7 days by utilizing dedicated block times for post-discharge visits. After receiving additional care instructions, Sarah got discharged and headed home to fully recover. On the day of her post-discharge appointment, Sarah had to do a last-minute errand, so she ended up canceling her appointment. That same week, the patient navigator runs a cancellation no-show report for post-discharge visits and notices that Sarah's name showed up in the report. The navigator calls the patient to reschedule and was able to get in touch with Sarah. The navigator helps reschedule the patient for early next week. Next week, Sarah showed up for her post-discharge visit, got checked in, and roomed. She then saw Dr. Kim and went over her recent hospital visit. Dr. Kim identifies that Sarah would benefit from a new walker and possibly the ACM program. To double-check that Sarah qualifies for the ACM program, Dr. Kim opens up the plan of care under the Visit tab. Dr. Kim sees that Sarah has a risk tier of 2, therefore a candidate for the ACM program. Dr. Kim introduces the ACM program to the patient. She leverages the ACM introduction script to provide an overview of the program and how it can benefit the patient. Sarah agrees to enroll in the ACM program. So Dr. Kim utilizes one of the DME smart phrases, specifically DME Walker, to help input the needed information so the walker can get approved by Sarah's insurance. Dr. Kim's continuity ACM case manager isn't on site today, so she tells Sarah her case manager, Isabel, will give her a call in the next few days. Dr. Kim sends a task to ACM, prints out the AVS, and discharges Sarah. The next day, Isabel reviews Dr. Kim's tasks and reaches out to Sarah. Isabel talks to Sarah and successfully enrolls Sarah into the ACM program. Isabel creates a care plan where she will call and check in with the patient each month and help Sarah secure the walker that Dr. Kim ordered, along with other care coordination needs. 3 months later, Isabel and Dr. Kim meet once a month to conduct their high-risk huddle to go over paneled patients that have been hospitalized, recently discharged patients that have not been seen yet, potential graduating patients, and patients that need actionable steps from the case manager and PCP. Isabel comes prepared with an agenda and needed pre-work to have a productive huddle. In the huddle, Isabel brings up Sarah and updates Dr. Kim that Sarah has been expressing that she is not 100% better. She had a minor fall recently, but it wasn't that serious. There is no one at home to keep an eye on her, and she doesn't have a lot of family support and wouldn't want to be seen as a burden. Therefore, Sarah's asking for a mobile wheelchair so that she can be more independent. Since it has been a few months since Dr. Kim has seen her, Dr. Kim asks Isabel if she can schedule Sarah a follow-up appointment for her. A few weeks later, Isabel is grooming Dr. Kim's upcoming appointments to opportunistically identify patients that would benefit from an ad hoc joint visit and sees Betty's name, a patient that Isabel has been having a hard time reaching out to. Isabel was about to send Betty a second outreach letter to get a hold of her, but now that the patient is coming in for a visit, it gives Isabel a chance to see the patient, realign on the care plan, and ensure that the patient agrees on the next steps. She notifies Dr. Kim and her flow manager of the ad hoc visit with Betty by sending a staff message to both of them. On the day of Sarah's follow-up visit, Sarah speaks with Dr. Kim about getting connected with a therapist. Dr. Kim tells Sarah that she can provide her with a list of mental health resources that her insurance can cover. Sarah would just need to contact them to get more information. Dr. Kim also offers to connect Sarah with her social worker who can guide her with community resources. Sarah agrees to getting the mental health resource list and getting connected with the social worker. So Dr. Kim utilizes the mental health resource list smart phrase to generate the resource list in the patient instructions field, and then submits a task to her social worker to connect with the patient. Once Dr. Kim is done with her visit, she hands it off to her flow manager to complete aftercare needs and discharge the patient. Sarah heads home with a clear understanding of her care plan and next steps. The end. Thank you for watching.
Created using Powtoon.